Welcome back guys. After discussing about the acute inflammation and inflammatory mediators, now in this video let's discuss about the chronic inflammation. So let's begin. Chronic inflammation. Okay, chronic inflammation. See what exactly is chronic? Chronic, the name itself is a prolonged. The inflammation is there for long duration, prolonged inflammation. Okay, prolonged inflammation. So for how much time? It's there for weeks, months and even years. Okay, so weeks to months. Usually it can be for years also. Okay, for the first 1 to 3 days it will be acute inflammation. After that, okay, the acute inflammation will be changing into the chronic inflammation. So what is the main difference between acute inflammation and chronic inflammation? Is the time period and also the cells, the type of cells which are involved. Okay, so usually this chronic inflammation is seen after acute inflammation. First acute inflammation will be there, after chronic inflammation will be there. So it follows acute inflammation. So what's happening in the chronic inflammation? See, inflammation is there, chronic for long duration of time because continuously there is repeated damage. So repeated damage is happening. So inflammation is continuing, as well as at the same time the body is trying to do the repair also. So in chronic inflammation, at the same time there is the damage of the tissues as well as the healing of the tissues. Damage, healing, both are happening at the same time. So the point which I want you to know is tissue damage and repair. The tissue damage and repair occurs at same time. So both are happening at the same time. So what are the causes of this chronic inflammation? So what are the causes? So causes of this chronic inflammation, usually the long-term infections, for example like persistent infections like TB, persistent infections. Like what? TB. The TB is not getting cured, the patient is not taking the anti-tubercular drugs, the TB is continuing for a long time, so chronic inflammation. Second thing, autoimmune diseases. What do you think? Autoimmune diseases are going to last for only 1-2 days? No, they are going to last for months, years together. So autoimmune diseases will also cause chronic inflammation. For example, like arthritis, rheumatoid arthritis, the inflammation in the joints is going to be there for lots and lots of time, 5 years, 10 years, 20 years. So years together there is continuous damage to the joints and the joints are getting healed. So both damage as well as the healing is happening at the same time. And for example, certain occupational disorders like pneumoconiosis, like exposure to silica, a prolonged exposure to silica, prolonged exposure to silica or some other like material. Okay, cotton dust or some other like the coal particles, like you are a coal worker or the silicon worker who is continuously inhaling some kind of dust particle. So continuous inhalation, continuous damage as well as healing by your body. So it's a chronic inflammation. Okay, all the pneumoconiosis will come under the chronic inflammations. So the point which I want you to know is here. Okay, you know the point and what are the causes? But at cellular level, what is the most important cell involved in the acute inflammation? You know it, it's the neutrophils. So, most important cell, okay, most important cell involved in chronic inflammation. It is, see in acute inflammation it is a neutrophil, in chronic inflammation it is a macrophages. Okay, macrophages are the heroes here. Now, my question to you, how many types of macrophages are there? There are 2 types. Okay, there are actually 2 types of macrophages. So, what are the 2 types of macrophages? There is something called as the M1 type as well as M2 type. M1 type of macrophages as well as M2 type of macrophages. See, M1 type of macrophages, they are activated because of the classical pathway. So, the classical pathway is going to activate the macrophages. The alternate pathway is going to activate the M2 type of macrophages. So what is this classical pathway? What is the alternate pathway? We will discuss now. So M1 type is a resultant. M1 type is the resultant of classical pathway. Okay, and when do you have the M2 type of macrophages? M2 type of macrophages because of alternate pathway. Now, my question to you. First of all, what is this M1 macrophage and what is this classical pathway? Look here, guys. Say, first classical pathway. Now, imagine there is this naive macrophage. Okay, it's a naive thing. See, this macrophage is having a receptor on its cell surface. So, this receptor is called as a toll-like receptor. Okay, toll-like receptor. Now, this macrophage, now it is receiving the antigens. There is an antigen that's entered into your body, or for example, like a microbe that entered into the body, and this microbe is going to have the antigens, right? Simple as that. So, microbe is there. This microbe is producing antigens. So, for example, like endotoxins. Endotoxins are the microbe. Now, these endotoxins, whatever I am showing here, it's coming and it's binding with the toll-like receptor. Now, this toll-like receptor is activated. Now, the toll-like receptor is activated. Now, these macrophages are activated. Now, these activated macrophages is giving the signal to the T cells. Okay, it's telling to the T cells because the more powerful cells, T cells. So, it's passing down the information. There is some bacteria in the body, some bad guy is there in the body. So, toll-like receptors are activated, the macrophages are activated, and they are producing the chemicals. Okay, they are producing the chemicals through which the T cells are getting activated. Now, these T cells will give the authority. Okay, you go and you go and attack the bacteria, whatever is there. So, the T cells will produce something called as the interferon gamma. So, this interferon gamma is a powerful stimulant for the macrophages. Now, the macrophages are activated. So, these macrophages which are activated because of the interferon gamma, now these macrophages are called as the M1 type of macrophages. So, M1 type of macrophages are because of interferon gamma. Okay, who is producing the interferon gamma? T cells. Okay, now what happens? This M1 type of macrophages, what they will do is, say this M1 type of macrophages, they produce the reactive oxygen species. Okay, ROS, reactive oxygen species, as well as cytokines. Okay, multiple types of cytokines through which they will try to cause the inflammation. Okay, they will cause the inflammation because of these are the inflammatory mediators, right? So, they will lead to inflammation. Okay, that's the point which I want you to know. So, this is the classical pathway. So, in classical pathway, which receptors are activated? Toll-like receptors. Who is activating them? Bacterial endotoxins or antigens. Which cells are being activated because of the macrophages? T cells. T cells are producing the interferon gamma, is going to produce the M1 type of macrophages. So, important point which I want you to know is it's the interferon gamma helps in the production of M1 type of macrophages. So, next the other pathway, that is alternate pathway. Okay, so alternate pathway. So, what exactly is alternate pathway? Sir, alternate pathway, you know it. Alternate pathway is going to produce the M2 type of macrophages. Simple. Here, it's not the interferon gamma that is activating the macrophages, but the other cytokines, some other cellular mediators are activating the macrophages. For example, say the T cells, the activated T cells. Okay, the T cell activation can be because of multiple reasons. There are multiple ways the T cells can be activated. Now, these T cells, instead of producing the interferon gamma, if they produce some other things like interleukin 4 or interleukin 13, see these fellows, okay, these cytokines, now they will come and act on the macrophage. Now, whenever they are acting on the macrophages, now they will become M2 type of macrophages. Okay, now they becomes M2 type of macrophages. The point which I want you to know is, see, M1 type of macrophages, they are pro-inflammatory, they are causing the inflammation, they prolong the inflammation, they are responsible for the inflammation, M1 type of macrophages. Now, M2 type of macrophages, what they do? They inhibit the tissue destruction. See, once the inflammation is completed, you need to do the repair. So, M2 type of macrophages are involved in the repair process. They inhibit the inflammation, they inhibit the classical pathway. Okay, they are all anti-inflammatory kind of. Okay, so M2 macrophages inhibit, right? First, they inhibit classical pathway. Next, they promotes tissue repair. Okay, tissue repair. Next, they also produce growth factors for the tissue repair process, growth factors. Next, growth factors for the angiogenesis also, so no new blood vessels will come, new blood supply, okay, more cells will come, so repair process, okay, angiogenesis, okay, angiogenesis. So, the point which I want you to know is, see, here cytokines are being produced, but except what? Except or other than interferon gamma. Okay. So any other cytokine other than the interferon gamma is going to help in the production of which type of macrophages? M2 type of macrophages. But interferon gamma is the one which helps in the production of M1 type of macrophages. Okay, M1 type of macrophages are pro-inflammatory, M2 type of macrophages are anti-inflammatory, mainly helps in the process of tissue repair. Okay, tissue repair. So with this we have discussed about the two types of macrophages. Now the points which I want you to know is the macrophages, different types of macrophages in different organs are called with the different names. Okay. Now the first point which I want you to know is, first of all, what exactly is a macrophage? Macrophage is nothing but a monocyte. Okay, in the bone marrow, the monocytes are there. The monocytes are converted into the macrophages. In the tissues, inside the tissues, they are converted into the macrophages. Now, these macrophages in different tissues are called with the different names. Okay, first monocyte from the bone marrow. This monocyte, it will enter into the tissues. In the tissues, they become macrophages. Okay, phagocytic things, you know it, macrophages. Now, the macrophage in the brain is given a different name, the macrophage in the liver is given a different name, the macrophage in the heart is given a different name, and the bone it's a different name. So, different places they are called as different types of cells. So, let me write here different types of macrophages. Okay. Now, first in the skin they are called as Langerhans cells. Langerhans, not Langhans, Langer. Okay, Langerhans cells. In the brain, any idea what do we call them? In brain, we call them as microglial cells. Okay, microglia or microglial cells. Next, in the bone, there are osteoclasts. Okay, you know it, right? Osteoblasts help in the bone formation. Osteoclasts, they will cause the bone resorption. So, what exactly are the osteoclasts? Osteoclasts are the bone destroying cells. They are nothing but the macrophages. Okay, by producing the acids, they will cause the bone resorption. They will break down the bone. Okay, now bone is also completed. Next, placenta. So, in placenta, they are called as half-bar cells. Half-bar cells. In the spleen, they are called as the littoral cells. In the lungs, dust cells. In the liver, they are called as the Kupffer cells. Okay, so there are multiple different names. Okay, in different tissue, they are called with different names. Okay, so they are all the macrophages, no doubt. They are all the macrophages. Now, let's begin with the histological appearances. Okay, in chronic inflammation, what you will appreciate? What can you appreciate? Say, in chronic inflammation, there is something called as a granulomas. Okay, for example, there is a chronic inflammation. For example, chronic inflammation is happening. Now, in that area, granulomas are present. What exactly is a granuloma? I will explain you. Okay. If the granuloma is present, then it is called as a granulomatous inflammation. If granulomas are not there, means it's called as a non-granulomatous inflammation. So, mainly chronic inflammation is divided into two types, granulomatous, non-granulomatous. Okay. So, what exactly is a granuloma, sir? If you ask me, granuloma, I will show you the picture also. In the center of a granuloma, actually to be very frank, it's simple, the area of chronic inflammation. Granuloma means area of chronic inflammation, which is surrounded by the macrophages. A focus of chronic inflammation. Okay, there is this focus of chronic inflammation. This is the area where inflammation is going on, chronic inflammation is going on. That area surrounded by the macrophages and other type of WBC. Okay, so if this is the area of chronic inflammation, this is the foci, chronic inflammatory focus. If that area, if it is surrounded by some macrophages, okay, macrophages are modified macrophages, you can call them, and they are also surrounded by some other type of WBC. So, this area is called as a granuloma, as simple as that. Okay. So, now let me write here one by one. So, there is a central, in the granuloma, what is there? In the central area, there is a caseous necrosis. The central caseous necrosis. The pink color material I will show you. Central area of the caseous necrosis is going to be there. Next, what else? Macrophages. Okay. Next, what else? Epithelioid cells. Okay, epithelioid cells will be there. What else, sir? Now you will get it out, sir. What exactly is the epithelioid cell? We have never heard about it. Epithelioid cell is nothing but an elongated macrophage. Okay, slipper-like. Okay, slipper-like or elongated macrophages are called as epithelioid cells. Okay, next, multinucleated giant cells. Multinucleated giant cells. For example, there is some enemy coming to you. Okay, you cannot just fight him alone. So you are going to call the help, right? You are going to get your help. In the same way, here also the one macrophage cannot deal with the entire inflammation, chronic inflammation. So macrophages will fuse. Okay, the macrophages will fuse and becomes multinucleated giant cells. They are nothing but these multinucleated giant cells. They are nothing but the fused macrophages. They are the fused macrophages, and epithelioid cells, what exactly are they? They are slipper shaped, but they are also macrophages. They are modified macrophages. So they are the modified macrophages, these are the fused macrophages. That. And at the end, what else will be there? So lymphocytes. Okay, lymphocytes. At the end, you are going to have a lymphocytic collar. Okay. So at the end, for example, if this is the area of granuloma, at the end, okay, so there are these lymphocytes present. They are forming a collar. The perimeter area is secured with the lymphocytes. So which type of lymphocytes? This lymphocytic collar is formed by T helper 1 cells. T helper 1 cells. That's also a very important MCQ which I want you to know. So with this, I have completed the granuloma. What exactly is a granuloma? An area of chronic inflammation or a focus of chronic inflammation where there is a necrotic debris. It's surrounded by macrophages, epithelioid cells, fused macrophages called as the multinucleated giant cells, as well as the lymphocytic collar is there. At the end, there is a lymphocytic collar which is made up of the T helper 1 lymphocytes. Now having said that, look here, this is a granuloma. I have explained you in the center, what is there? In the center, there is a pink color material. So what is this pink color material, sir? It's amorphous eosinophilic material. That's nothing but the caseous necrosis. Okay. Now what else will be there? Sir, here macrophages will be there. And if you appreciate here, there is elongated macrophage. This elongated macrophage is called what? It's an epithelioid cell. Okay, it's an epithelioid cell. Okay, and not only that, here you can see one more cell. Okay, one more cell with multiple nucleus. So this is called as a giant cells. They are the fused macrophages, multinucleated giant cells. Okay, see in the name it's a giant cell. So what is this Langhans? Later I will explain you. Okay, so there are epithelioid cells, slipper-like. There are giant cells, and at the end, I hope you can appreciate, sir, what are these cells? So these are all the WBCs, T helper 1 cells. These are all the T helper 1 cells. Okay. So this is a cluster of epithelioid cells surrounded by the lymphocytes. Which lymphocytes? T helper 1. So that is called as the lymphocytic collar. So this is the basic structure. Okay. Now the one important point I want you to know here. Look, what is this? Lymphocyte collar. So this lymphocyte collar, it is made up of T helper 1 cells, but this is absent in one type of granuloma. Usually granulomas consist of this lymphocytic collar. But in one condition, yes, granulomas are there, but those granulomas do not contain this lymphocytic collar. That is called as a naked granuloma. So those naked granulomas are seen in sarcoidosis. So naked granuloma. Okay, naked granuloma or lymphocytic collar absent. Here the lymphocytic collar, if it is absent, then it is called as a naked granuloma. It is seen in sarcoidosis. Okay, it's called as a naked granuloma. Done. Sarcoidosis. Now, let's discuss about the multinucleated giant cells. Okay, the giant cells, the fused macrophages. Okay, multiple nuclei are there. Now, in different conditions, these multinucleated giant cells, okay, in multiple chronic conditions, in multiple chronic inflammations, these multinucleated giant cells are given with different names. They are called as different names. But at the end of the day, they are nothing but the fused macrophages. Okay, they are nothing but the fused macrophages. Done. So, let's begin the topic, multinucleated giant cells. Okay. So, multinucleated giant cells are nothing but the fused macrophages. Look here, in one single cell, what you will find out? You will find multiple nuclei. So, that is a multinucleated giant cell here. Now, see these multinucleated giant cells, usually they are present in our body. Okay, they are present in our body. This is like the fused macrophages. Where, sir? Physiological. What are the physiological examples? Okay, the physiological examples of these multinucleated giant cells. One example is osteoclast. Okay, osteoclast, they are the macrophages, true. But they are physiological. All the time in our bone, osteoclasts are there. Now, if you look at an osteoclast, it's going to look like this. It's a multinucleated giant cell. Many number of macrophages or many number of osteoclasts, they will fuse and form one single cell with multiple nuclei. Okay, so osteoclasts are physiological examples of multinucleated giant cells and megakaryocytes. Megakaryocytes. These megakaryocytes are the one which forms your platelets. Okay, they form your platelets. So, these megakaryocytes are also big cells. In the name itself, it's saying megakaryocyte. It's nothing but a multinucleated cell. Now, let's discuss about the pathological examples. Now, pathological giant cells. So, pathological examples. The first pathological example which I want you to know. First, look at here. See, this is a giant cell. Okay. Now, I hope you can appreciate that inside the cell there are multiple nuclei. In which condition you will see such kind of multinucleated giant cell? First of all, it's called as, the first one, it is called as Warthin-Finkelday giant cells. So, Warthin-Finkelday giant cells, it is seen in which condition, which infection? Chronic infection, that is called as the measles. Okay, so it's seen in measles. See, in measles, what you will see, what exactly you are seeing here. So, there is intracytoplasmic as well as the intranuclear inclusions. Okay, both within the cytoplasm as well as within the nucleus, you can see the inclusions. See, why this is important, later you will understand. Okay, see, in measles, both you will see intracytoplasmic as well as intranuclear inclusions. Okay, in this Warthin-Finkelday giant cells, both intracytoplasmic as well as intranuclear inclusions. Okay, this will help to differentiate with some other conditions. Okay. Now, after this, look here. What you can see here? Here also there is a cell. Okay, there is a cell with multiple nuclei present. Okay, with multiple nuclei present, but it's looking like a horseshoe shape, right? It looks like a horseshoe shape. So, what is this giant cell in which the nuclei are arranged in the form of a horseshoe? So, this is called as, first of all, this condition, it is TB. So, in TB, what you see is Langerhans giant cells. Again, I am telling you, giant cells are nothing but macrophages. Giant cells, they are nothing but the macrophages, but they are fused. So, Langerhans giant cells. What you will see? In Langerhans giant cells, the horseshoe shape. Okay, that is the important thing. Next, here look, what is it? This is also a giant cell with a multiple nuclei, but these nuclei are arranged haphazard. There is no something like, peripherally they are not arranged like, in the periphery, they are not horseshoe shaped. No, it's not like that. See, it is a haphazard arrangement of the nuclei. So, this is called as a foreign body giant cells. Okay, if you have any foreign body lodging, for example, into your tissues, some foreign body have lodged, maybe a pin, maybe a thorn or something. If it is getting lodged into the tissues, then inflammation will start, chronic inflammation will happen, multinucleated giant cells will come there. So, those multinucleated giant cells are called as a foreign body giant cells. Let me write here, foreign body giant cells. So, what you will see in the foreign body giant cells? Haphazard arrangement of the nuclei. Okay, haphazard arrangement of the nuclei is going to be seen. Now, look here. So, this is one more condition. Again, you can see here a giant cell, but here what you can see is all this nuclei, they are arranged in the periphery. Okay, all of them almost here also should be there. For example, they are all arranged in the periphery. So, these giant cells are called as the Teuton giant cells. It is seen in which condition? Which chronic inflammation? Called as xanthomas. Okay. So, in the condition called as xanthomas, what you will appreciate is Teuton giant cells. Teuton giant cells. Now, look here guys. Okay, now I am going to show you two similar images. For example, look at this. Okay, look at this and look at this. They are just looking like almost the same, similar kind of thing, right? First, let me write here this giant cell what you are seeing here. Okay, this is a cell with owl-shaped nucleus, owl-eye nucleus. Okay, the nucleus which are looking like owl eyes. See, these giant cells are seen in a condition called as Hodgkin's lymphoma. Hodgkin's lymphoma. So, this giant cell name, it is called as RS cell, Reed-Steinberg cell. Okay, Reed-Steinberg cell. So, this Reed-Steinberg cells are seen in Hodgkin's lymphoma. Okay, no doubt. But one more condition, see, it's almost looking like the same thing. Okay, almost looking like the same thing. So, this is a cell which is infected with a virus, CMV, cytomegalovirus. Okay, now how to differentiate this with that? Now, look here. Here it's looking like the intranuclear inclusions are looking like dark blue. Okay, here it is pink. Okay, the nuclei, it's a pink color. Here it is dark blue color. And one more thing, here if you appreciate, see, there are intracytoplasmic, there are so many inclusions are there. See, intracytoplasmic inclusions are there. So, that's how you differentiate a CMV infected cell, okay, CMV, cytomegalovirus infected cell from a Hodgkin's lymphoma based on the color. That's blue, here it is pink. Their intracytoplasmic inclusions are there. Okay, that's the point which I want you to know. So, after that, here I have found it on the internet. I found it little like, easy way to remember. See, it's the horseshoe shaped nuclei. Okay, horseshoe shaped nuclei. It can be on both the sides or it can be on the single side. But at the end of the day, horseshoe shaped nuclei are present where? Horseshoe shaped nuclei are present in a condition called as the TB Langerhans cells. These are the Langerhans cells with the horseshoe shaped nuclei. Okay, not Langerhans, it's a Langerhans. Okay, Langerhans. Now, look here, Teuton. See how the Teuton is going to be. Teuton means round. Teuton means round. So, in foreign body there will be haphazard arrangement. This is, you see, nuclear getting scattered. It's a haphazard arrangement. Okay. See, in tumor it will be same, almost like the giant cells will also be same, because cancers are also chronic inflammatory conditions. But you are going to have a very hyperchromatic pleomorphic nuclei with a different sizes, different shapes, and hyperchromatic nuclei. Here it's not that much hyperchromatic. Okay, is a point which I want you to know. Next, see, in this condition, there is one more granuloma present. It's also a granuloma, sir, but it's looking like almost like, the small branches are there. Okay, this is called as a stellate granuloma. Okay. So, stellate granuloma, it is seen in which condition? Cat scratch disease. Cat scratch disease, and one more condition called as a lymphogranuloma venereum. Lymphogranuloma venereum. Okay, LGV, lymphogranuloma venereum, because of chlamydia trachomatis. Okay, chlamydia trachomatis. Okay, infection with the chlamydia trachomatis. Lymphogranuloma venereum as well as in the cat scratch disease. You will see what kind of granuloma? Granuloma with, like, the branching kind of appearance, which is called as the stellate granuloma. Next, look here. See, this granuloma, it's looking like a donut, right? It's looking like a donut. So, this is called as a donut granuloma. Like, this is a donut. So, this is a donut granuloma. Donut. So, these donut granulomas are seen in which condition? Donut. I used to remember like this, same, like, the whole thing. It's a Q fever. Q fever is because of which organism? Coxiella bruneti. Okay, the Coxiella bruneti, Q fever. So, donut granulomas are seen in, if a patient is having Q fever, he is going to have that fever for a long time. So, the patient tissues, what you can see is this donuts granuloma. Next, one more granuloma which is looking like a stick, a rod shaped. Okay, say this will again come in your microbiology also. This is called as duck granuloma. Okay, DURCK. Okay, it should be called as a duck granuloma. Okay, duck granuloma. So, duck granuloma, it is seen in cerebral malaria. Because of which organism? Plasmodium falciparum. Okay, Plasmodium falciparum is going to cause the duck's granuloma, which is seen in cerebral malaria. Now, we have completed the different types of granulomas. Okay, different types of granulomas seen in different conditions. So just as a recap, okay, one by one. See, we have know what exactly is the granuloma. It is seen in chronic inflammatory conditions. First, this granuloma, measles. This is the Warthin-Finkelday chain cell. This is the Warthin-Finkelday chain cell seen in measles. Both intracytoplasmic as well as intranuclear inclusions are going to be seen. Now, the first granuloma, see, it's a horseshoe shaped. This is Langhans chain cells. Langhans chain cells are seen in TB. Now, this one, it's a haphazard nuclear arrangement seen in foreign body granulomas. Next, round shaped arrangement, Teuton chain cells seen in xanthomas. Now, this is hyperchromatic, like the nuclei is seen, the blue color nuclei is going to be seen. So, this is definitely cytomegalovirus infected cell, and this is the Reed-Steinberg cell which is seen in non-Hodgkin's lymphoma. Next, this is the stellate granuloma seen in cat scratch disease as well as granuloma venereum seen in Chlamydia trachomatis. Donut's granuloma seen in Q fever, and the Doug granuloma which is going to be seen in cerebral malaria because of Plasmodium falciparum. So, now let us write some important points. For example, the patient is having TB. Okay, if a patient is suffering with a TB. Now, a TB patient is going to have caseating granuloma or non-caseating granuloma. See, I have said you the granulomatous inflammation, granulomas are of two types. See, there is a central area of necrosis, then it is called as a caseous granulomas or caseating granulomas. If there is no necrosis, then it is called as a non-caseating granuloma. See, the very important question which was asked in the many exams is TB have both caseating as well as non-caseating granulomas. Okay, both caseating as well as non-caseating granulomas. Now, what are the conditions in which granulomas are there but non-infectious granulomas? There is no such infection, there is no Q fever, no cerebral malaria, no measles, but granulomas are there. So, non-infectious granulomatous inflammations. So, non-infectious granulomas. Non-infectious granulomas are seen, at least I want you to know the three conditions. One is sarcoidosis, vasculitis, Crohn's disease. See, you already know in sarcoidosis, there is no lymphocytic colors, naked granulomas are going to be seen. Vasculitis, in vasculitis condition, there is, for example, like Wegener's granulomatosis. In the name itself is there, granulomatous inflammation. Okay, Wegener's granulomatosis. And Crohn's disease, you know it, Crohn's, I used to remember something like Crohn's is an inflammatory bowel disease, right? Crohn's is an inflammatory bowel disease. So, there are two types of inflammatory bowel diseases, Crohn's disease as well as ulcerative colitis. See, we are writing the letter C something like G, right? It looks like G. Okay, C is more similar to G. So, Crohn's is granulomatous inflammatory disorders, granulomatous inflammation is there. So, with this, I have completed all the important points about the chronic inflammation. So, in the next video, we will be discussing, okay, in the next video, I will be discussing about what are the outcomes of the chronic inflammation, okay. What are the outcomes? In that video, I will be mainly discussing about the wound healing topic, hypertrophic scar as well as the keloid things. I hope this video is helpful. Thank you.